Thanks for staying with us on The Real Story. Well, opioid addiction continues to claim lives. The number of deaths on the rise, and that means that more and more people are in need of support right here in Connecticut. And with that, outreach services and addiction prevention resources need more funding. Right now, communities across Connecticut are getting money from a $26 billion multi-state settlement that requires pharmaceutical distributors and manufacturer Johnson & Johnson to distribute $300 million to our state over 18 years. But when this money reaches towns, what will it do for the people in them? And who decides how these funds are allocated? Joining me right now is Jess Morris from the Perception Programs in Willimantic. Her life has been touched by addiction in many ways, and now she spends her days helping those who struggle with substance abuse disorder, and of course advocating for resources as well. And Miranda Mahoney from Griswold Pride joins us as well, which stands for Partnership to Reduce the Influence of Drugs for Everyone. She's a decision maker when it comes to allocating these funds in her own community. Thank you both so much for joining me this morning.
Thank you.
All right, Jess, I want to start with you because you've been touched very personally by the opioid crisis. You battled addiction yourself.
I did. I'm actually coming up on 10 years in remission.
Congratulations.
And it was the pills that was my substance of choice. So it's even more dangerous now because the pills are being made by drug dealers and being passed off. And, you know, now it's not the pharmaceutical companies that are killing people, you know, and getting them hooked. It's now dangerous. One pill can kill.
Now, you have dedicated your time to being a resource for people in the community with this Perceptions program.
The mobile mat van, yeah.
Yep, the mobile mat van, and you, or Perception programs rather. You said you have some resources in Willimantic, but you also have a van that you drive around and provide resources like Narcan and help support.
Yep.
Tell us about that and what you're seeing out there.
So the mobile mat van goes to 6 different towns in we go to Jewett City, Willimantic, Danielson, Putnam. I mean, we're all, you know, 4 days a week, all day. And I have engaged with over 100 individuals. We've had 17 Suboxone inductions, which means instead of them having to call a doctor's office and say, oh, well, you want to start this med that could save your life? 2 weeks. Wait 2 weeks. Well, they might die in that 2-week period or change their mind, you know? So this is a very low barrier, easy accessible, non-judgmental way to get people into care and keep them linked in to care.
Do you think it's gotten, or how bad do you think it's gotten in the 10 years that you have been in recovery?
So much worse, you know, because I at least didn't have that fear that I would die if I took one pill. I knew it was coming from a pharmaceutical company. I knew what I was taking. These days, you just don't know. You literally, unless you went to the pharmacy yourself and picked it up, you cannot trust that it isn't tainted with fentanyl.
Right, that's pretty scary.
Yeah.
Miranda, you are with an organization that's going to help distribute the money in Griswold, right?
Correct.
How did the organization get picked? And tell us about the town's application process.
Sure. So we are a community coalition, drug prevention coalition for the town of Griswold, and we bring together 12 sectors of the community to work together to prevent drug use. When the town opted into this settlement funding, the Board of Selectmen voted unanimously to allocate that money to our coalition, knowing that we would know best because we represent 12 sectors on what to do and how and what to do with the money once we get it.
So what are you going to do with the money when you get it? Where's the need?
So we're excited for this because it gives us an opportunity with a lot of flexibility. So with grant funding, you get, you know, there's very strict guidelines that you must adhere to, outcomes that you must meet. But with this funding, we have a lot of flexibility on what we want to do. And we actually want to start a pilot program that is modeled after a pilot program out of South Carolina that would provide post-overdose outreach using EMS and an innovative new idea using prepaid cell phones. So it eliminates a lot of the barriers and challenges that we were facing with implementing post-overdose outreach. In Jewett City and Griswold, we have brought together, and we've worked really hard bringing in a really comprehensive approach to fight the opioid crisis in our town, where we have prevention, harm reduction, treatment, recovery services, but we were missing that post-overdose outreach. So this would provide EMS equipped with a care package to leave after an overdose to a surviving client or a surviving victim or their family member. And a recovery coach would make contact with the cell phone within 72 hours, either by text or call. And after so many attempts of not establishing contact, we would be able to provide a knock on the door. But it eliminates even consent. So now the EMS doesn't have to take the time to establish consent with the surviving victim. It eliminates that barrier.
Because they're making
now
contact.
we're leaving a package, and it's their choice to
Take the package.
Take the package.
I see, I see. What kind of difference could that make, do you think, Jess?
Huge. I mean, I just think from so many angles, right? Like the stigma. I am a huge advocate of like reducing stigma, because I think it is the biggest barrier to people getting treatment, especially medications to treat opioid use disorder. There is so much stigma still, even though it's the gold standard of care, right? Like it works, but people, you know, different groups or whatever just have opinions about it not being really recovery, although, you know, I feel like I am living proof that for the last 10 years, you know, those medications have helped save my life. So back to the overdose, I just think not having to go face to face with somebody when you're in that vulnerable position, right, after an overdose, you don't have to, like, it just eliminates a lot of the stigma. And like she said, it's a choice, you know? You don't have people all in your face like, oh, do you want to do this? Do you want to do that? You get to do it in the privacy of your home and not have to worry about.
And a little bit on your own time, because it's
Right.
a text message. You can kind of sit in it for a second, answer when you want to.
Right.
That makes sense.
Absolutely.
So do you know how much money the town of Griswold is going to be allocated?
We're getting a little over $6,000, so we're hoping that this is just the start of the program where we can get it up and running, collect some data on it, and then eventually go for additional funding.
And this program that you're creating, that's not the only resource that's getting the funding, right? Or are you in Griswold, is that the only thing you're launching? Or is it getting distributed to several different
This
aspects?
is our main idea to
Main
run
idea.
with at this point.
Okay. And Jess, do you know, is the mobile van getting funding from this?
I am not aware
Okay.
of perception programs. I know that we go after different grants, you know,
Yeah.
all of the time, but I don't know specifically.
Do all of the towns and cities, and I know you're just with Griswold, so that's what you know, but are they aware of what they're allocated at this point?
They should know at this
They should
point.
know, okay.
Yes.
And from what I was reading and what we were talking about before, more money is coming down the pipeline as these settlements come in. Sounds
That's
like.
my understanding.
That's
yes.
your understanding too as well. Okay. Well, and how long do you think this program is going to take to get up and running?
We're starting our meetings next week, so we're hoping to get this up and running. This has been an idea for, I think it came to us in the spring, and this isn't just, you know, something we heard about. This came from the CDC, who implemented this pilot program down in South Carolina, Lexington County, and it's bringing together public health, behavioral health, and the EMS, you know, the frontline people. So we're really excited to get this up and running because, you know, with a program that's so new, it's hard to go for grant funding for that. So this opioid settlement funding is just, when we heard it, it was just opened up so many doors because there's so much flexibility with it.
Yeah, that's exciting. All right, let's talk about accountability right now. Big Pharma having to pay a massive amount of money. We're talking about people's lives, people losing their lives, people's lives ruined because of this, losing family members. Is this enough to hold their feet to the fire? Jess?
There isn't anything that could make it right. Nothing.
If there was something else that Big Pharma would have to do out there, is there anything, or at this point, is it just
Create a cure.
interesting?
I mean, that's really the only thing, but I think they should just all go away.
Yeah.
Pay up and go away.
And change their policy so this doesn't happen again.
Absolutely.
All right. Well, thank you both so much for coming on the program and talking with us. Resources for people who may be watching this and have a loved one who's suffering from addiction, or maybe they're suffering from addiction themselves. Where's the best place to turn, would you say?
I would say that, you know, Demas has a great website, but if you are in any of the areas that we cover, you can call the mobile map van at 860-336-9412. You can go to Perception Programs Facebook page, our website, Griswold Pride. Matt's Mission is another great resource in the area. And I think we just all take a really great collaborative approach. We really work well together and do what's best for the person. We meet them where they're at. Literally, I go to where they're at, you know. And
it's so important. Opioid addiction affecting people from all walks of life. So this is touching a lot of people, I'm sure, even who are watching right now. Jess Morris, Miranda Mahoney, thank you both so much for coming on The Real Story. Appreciate it.
Thank you.
All right, and that does it for us on The Real Story. If you want to watch these segments again, you can head to fox61.com or you can download the Fox 61 app. And please watch The Real Story every Sunday at 10 a.m. right here on Fox 61. Have a great morning.